Hi, I'm Dr. Deepti Jain, and I'm a board certified orthopedic spine surgeon. I get questions all the time about neck and back, and do I really need an MRI to actually help me determine the source of my back pain and neck pain? Well, the reality is that's actually a nuanced question. And sometimes yes, and sometimes no. So typically, when a patient is evaluated by a spine surgeon, we start with x-rays. And x-rays of the neck and the low back can give us a lot of clues about what's going on. So for example, if there's spinal instability or what we call spondylolisthesis, where one of the bones shift on the other, that's something that we can typically detect on an x-ray. And that gives us a lot of clues about the source of pain. So a degenerative spondylolisthesis, those are big words, at L4, L5 is one of the most common things I see in my office. And I know exactly that that patient is going to present with back pain that radiates down their butt. I can know exactly what symptoms the patient's going to have by looking at their x-rays before I even walk in the room. And so in that setting, do I really need an MRI to help me diagnose what's going on? No. However, the MRI often gives us a lot more information. It'll probably confirm what I already know, but it might, and I don't know this ahead of time, it might show me other areas of neurologic compression that could be causing symptoms. Separately, sometimes I have patients who have a lot of back pain who have completely normal x-rays. And in that setting, patients will also ask, well, should I get an MRI? Is it going to be helpful? And the reality is I don't know before I order the MRI until I actually look at it if it's going to be helpful or not. Sometimes, indeed, it is helpful. It will give me more clues. For example, maybe the x-ray looks normal, but I see a big disc herniation on the MRI that could be pinching a nerve. In that case, it's very helpful. Other times, I'll get an MRI in a patient who has a normal x-ray, but then their MRI also looks normal. So it's hard to know ahead of time.